Hey everybody, welcome to our latest installment of Lunch and Learn from Your Desk. Today we are going to be injecting Juvederm, and we have Miss Erin with us today, who has never had any injections, and she's really excited about it and a little bit nervous perhaps. But we've talked about some breathing techniques and she's going to be just fine. We'll be checking on Erin in just a minute. But why don't we come on in a little closer? And Erin is interested in a more defined lip. She has told me that she would like for the lateral part of her lip to show a little more. As you can see, her lip has good architecture. She has a very good cupid's bow, nice philtrum. We probably won't touch too much of the volume, but we will start on the lateral edges and just enhance the lip that she already has so that she gets a better pout. Okay? Yes. So we're going to start with our insulin syringes, and I'm going to tilt you back just a little bit, Erin. The most important thing that you can remember to do during this process is to breathe, okay? So I want you to take a deep breath in, and then exhale. And as we do our injections, we want you to exhale as well. Okay, so we want to be very subtle when we start with this filler. This is an hyaluronic acid filler, so it's going to look very natural. It's a good option for injecting into the lips for this purpose and not just for volume. Okay, take a deep breath in. Good, exhale, big pinch. So we just start at the lateral edge and just put a little bit of product in small aliquots along that vermilion border. Good. Big deep breath in. Good. Exhale. Perfect. All right, good job. This really allows us to control the amount of product that we're putting in. Good. Exhale, pinch. And do it in a way that she will be comfortable with. Although this is a filler that you can reverse if a patient is unhappy, we don't like to do that, and we don't often have to do that. Okay, one more time. Good. Exhale. This is about as medial as we're gonna go. That looks good. I like that. So if you come in closer, you can see that we haven't even really made her lip any bigger. We've just pulled it out so you can see more of the lip on that lateral edge compared to the other side. Nice natural looking result. Now it's always important to balance. So we don't necessarily want a larger lip on the bottom. She has good fullness, but she has some of that same issue on that lateral edge. So we're just gonna do the same thing on the bottom. Big deep breath in, Erin. Good, exhale. And I forgot to check in with Erin, and now she has a needle in her lip, so we can't, but we will in just a second. Perfect. Good.
So there's immediate results.
Yes, you get immediate results with the filler. Big deep breath. Good. Exhale. Pinch. Good. Keep it superficial. Good. We'll do one more and then we'll ask you how it is. Good. Exhale. Pinch. Perfect. All right. So far?
Good.
Not too bad? Mm-hmm. Good. And there's lidocaine in all these products, so as we do it, she starts to get more and more comfortable as we go. I like that. I'm going to do the same thing on the other side with another insulin syringe, teeny tiny needle. That's why I like to use these, because you get less bruising when you're using this 31 gauge needle, and it hurts the patient less.
Was she numbed before as well?
She also numbed before, yeah. We let her numb for about 20-30 minutes with some betacaine, lidocaine, tetracaine. Okay, Erin, big deep breath in. Good. Exhale, pinch. Good. Good. Deep breath. Good. Pinch. Looks good. Okay. Big deep breath. Good. Pinch. Okay. Last one. Big deep breath. Good. Okay, is it true that as we get toward the middle it hurts a little more? Yeah. Mm-hmm. Yeah. Just gonna mold that. Good. So she's not interested in the duck look. She wants to look natural. She wants to look like herself. And we're gonna accomplish that goal here. All right, more balance on the bottom. Big deep breath. Good. Exhale. Pinch. Good job. Pinch. Perfect. Good. Pinch. Good. Now we're using one syringe here. We have plenty of product left. I wanted Erin to be comfortable with what we were doing. So let's let her see a mirror.
They say that's gotta hurt. What's your feedback?
Not at all. It's not as bad as I thought it was going to be at all.
I think that's the best you can expect to hear from a patient, is that it's not as bad as you thought it was going to be.
Yeah, I
Good.
like it a lot.
You like it? Mm-hmm. Good. So you've also noticed as we mature through life, the corners of our mouth start to drag down a little bit. And just by putting that little bit of filler in the corner, we turn that edge back up in a really natural and unassuming manner. So I think that's good. Now, go ahead.
How long
Any
will
questions?
it last?
This filler lasts a year, so 12 months. Whenever you put a filler into an area that you're constantly moving, you could affect the longevity of the product. So you may not get the full year, but at least 10 to 11 months. But in the lips, I tell people a year, and then we'll touch up in about 10 months anyway.
And then pre-procedure, what?
Pre-procedure, yes. So what you did not see was that Erin came in and we cleaned her off. We took off all her makeup. We wiped her down with an alcohol prep, and we applied a strong topical numbing agent called betacaine, lidocaine, tetracaine that we let sit on the area for almost 30 minutes. And in the real world office setting, we try to do that as well for as close to 30 minutes as we can, because that is going to provide a lot of comfort for her, which she's going to expect. We correct to the level that we are happy with, expecting it to swell over the next couple of days. So tomorrow will be the peak of the swelling. I like to ask patients to not only use the ice, but to also take antihistamines that are non-sedating, like Zyrtec or Claritin. Double the dose starting today, tomorrow, and then on the third day as well. And most patients are able to return to their normal activities without anybody really knowing anything has happened. But yeah, I think that looks good. So we're going to stop right there. We have used about a half of the syringe. She's not interested in volume, but if she was, we would go back into the upper lip and into the lower lip, making sure that we maintain that good balance. She has great balance where her bottom lip is about 1.6 times as large as her top lip. And that's why patients will have lips that look normal, because you maintain that proportion that's appropriate. If you start doing too much in the upper lip, that's when you get the duck face where it looks weird and it looks unnatural, and which nobody here wants.
So for a cosmetic consult, that's what you go over with every individual patient.
Yeah, we'll talk about that. First of all, we're going to ask the patient what their goals are, because everybody's goals are different. Some people want a larger lip. Some people just want to smooth out the lines around their lips. Some people want to revive their lips and not necessarily make them larger, but sort of correct the deflation that's taken place over time. But we talk about all of that, as well as prep the patient for what the aftermath will be like as far as swelling, any bruising, what the pain will be, and then get a plan and get it on the books. I like to do lips on Tuesdays and Thursdays, depending on the patient's schedule, if they work outside of the home or not, so that they can resume their normal activities with as little disruption as possible. We are going to be injecting on Friday, November 17th for your last shot before the holidays. And that is going to be a filler clinic on a Friday, which I don't typically do, but we'll be here in the morning getting everybody ready for Thanksgiving. It's your last chance. And we're going to be offering specials that day where you purchase one syringe of filler, the second syringe is 50% off, and then all Botox will be $11 a unit that day as well. And then that night, I'm going to be injecting at the Market Bliss Party, which is part of the Junior League of Birmingham's Market Noel, which is insanely popular in Birmingham event. The party will feature me and Tanya Jones of Tanya Jones Salon Spa. Their team will be there providing services. They're going to have a special drink called the Blistini. For everyone that you purchase, your name will be entered in to win some prizes. And we're going to be giving away a skin wellness package that's valued at $500. So come on out. Botox that night will also be $11 a unit, and we'll be doing it at the event if you would like. For the last shot, before the holidays next Friday, we are asking that people call and get an actual appointment so that we will be prepared for the patients that are coming in that day. Any other questions? Y'all want to check back on Erin?
Check on Erin one more time.
She's still not swelling. She still looks good. I think it looks awesome.
Awesome. Thank
Perfect.
you.
Any other questions, y'all?
That's it.
All right.
Bye-bye.
Thanks, guys.